Hi, I want to talk to you a minute about dealing with difficult patients. We all can encounter a difficult patient, whether it be in the mall of the hospital or actually in a patient room or anywhere else in our facility. And it's important that we all know this is great for nurses, ancillary staff, EVS. All of us are in a position where we will encounter difficult people, and this is just a time I want to talk to you about that. The first thing I really want to talk about is empathizing with these people. We don't get people in the hospital situation at their best. They're stressed, they're anxious, they don't know what's happening, they don't know what's going to happen next. So if you just try to remember that we're not getting you at your best, and so I'm going to give you a little grace in this situation. You've got to actually listen. They just want to vent. A lot of times they're unsure of what's going on. They misinterpret things, and they just want to tell somebody what has happened and why they're upset. And you need to be able to actively listen to them and just stay in control. A lot of times, if it's something directed towards you, it's upsetting, and you need to stay calm, cool, and collected when at all possible. Don't let them see that you're getting upset. Don't let them ruffle your feathers. Just try to be calm, listen before you speak. That is so important. And then don't take it personally. You're not a bad person. You are not intentionally trying to make the person angry. At least I hope you're not. But don't take it personal. Just let them vent through the situation. And then, we need to say we apologize. You may not have done anything wrong, and I'm not asking you to admit to wrongdoing, but acknowledge them. Try to connect with them on some sort of level where you can identify with them or understand what they're going through to a degree. I encourage you not to say, I know how you feel. That's a little bit gaslighting to some people, so maybe just recognize their frustration. Don't argue with them. Under no circumstances do you need to argue with the patient. You can stand your ground in a professional manner by listening and saying, I understand you're frustrated. I want to make the situation better. Here's how I can help. In no way am I asking you to fold and admit wrongdoing or admit to something that you did not do. But I'm also asking you to acknowledge if you did upset them in a way and take ownership of that. You need to set boundaries with people. People will push and see how far they can go with something, and just don't argue, stand your ground, identify, try to connect with them, try to see from their perspective, but put limits on what you allow. Nobody's wanting you to be a punching bag by any stretch of the imagination. And then something that's pretty touchy is that if you're under a whole lot of stress, whether it be work stress or personal stress, it can affect your interactions with patients. And when you encounter somebody who you know is under a lot of stress, they're in a situation, a medical situation, and they're upset, that can escalate things. So try to keep your stress at home or minimized. And I know that's easier said than done, but sometimes you just need to take a deep breath, recognize the situation, separate the situation. Like, am I reacting to this because I'm under a whole lot of stress? And then put yourself in their situation and try to really think about your reaction. And by all means, please control your body language. This crossed arm, aggressive, nature, keep that out of it. I mean, immediately if you cross your arms, that says a ton to people, and that's a negative connotation, and you all know that. So try to keep your arms down, your shoulders back, good posture, open. Keep your chest open and not blocked off. Try to keep a neutral face, no smirks, no scowls. And I know this is all very difficult, but those are things that in this situation you need to think about. Like, okay, Tiffany, put your game face on, stay calm, take a deep breath, be relaxed, and just listen and let the person say their piece. And then if you're in a situation where it's uncomfortable, you feel yourself getting anxious, you feel yourself being defensive, ask for somebody to help you. Tell the patient, I understand that you're upset with me or upset with the situation, and I really want to help you, but we're not getting on the same page here, and I want you to be happy. So give me a minute. I want to find somebody that can step in and really talk to you and give you an opportunity to express yourself and see if we can get this situation resolved. Those are all great ways to deal with an angry patient or an upset patient, and I hope that it helps you. Thanks. Have a great day.